Okay, so I think we're live. Hey everyone, welcome. We're so excited that you're here with us. We're going to give everyone one more minute to just allow technology to frustrate us just a little bit longer. If you have any questions, feel free to type in the chat. That's how we can see if you can see us, if you can hear us, or if you can't. And if you have any questions, feel free to type it in the chat as well. Yay! Uh-oh, Bonnie said she couldn't log in YouTube. Of course. Every single day, technology makes me look like a fool. And I'm still not used to it. Well, I will try to sort that out. What we're going to do, Denise, I'm going to stop sharing my screen. You can share your screen.
Now, let me share my screen.
And I know some of you sent questions. So we do have some questions that if we have time, we'll get to today. But if you have any questions as Denise is talking, then please post them in the chat. And then we'll also stop a couple times through the presentation to just give you a second to process, give you a second to ask any questions that come up.
All right, are we good on my screen?
Yes, we have the fun house, the fun room.
With I love that. That just is not good on anybody's day.
So Denise, if you switch over to your Firefox browser.
Yeah? No? Is this Google? Is this Chrome screwing me up again?
Yeah, if you switch, I think if you're sharing your screen, you switch to where you have the presentation.
Whoops.
There it is.
Is that working for us?
Yes. So if you see the presentation in chat, please let us know. We're going to go ahead and get started so we can make sure that we respect your time and we get through it as quickly as possible. Okay, Denise, everybody can see you and hear you. It's perfect.
All right. Well, technology usually winds me up in the back 40, so let's just hope it goes smoothly. So Bethany, do you want me to go ahead and just jump right in, or?
Yeah. So thank you all for joining. We really appreciate it. Today is going to focus on when and how to enroll in Medicare. So if those of you who are new to Medicare, welcome, and I'm sorry.
No, it's a good time. It's a good place to be.
This is why Denise is here. So it's rather complex. There's a lot of nuances and ins and outs, and I'm so excited that Denise is here with us. So this is Denise Anderson. She is a doll and a wealth of knowledge. So everything she's going to share with you is based off of her experience and learning through navigating this complex system that, if you're entering Medicare, is going to be a part of your process in your life as long as you need healthcare with your coverage and any needs that you may personally have, which change year to year. So this is really important, even if you're already covered, to get some of the new information of what's going on with Medicare. I'm going to hand it over to Denise because nobody wants to hear what I have to say, and she is the star.
Thanks, Bethany. So my name's Denise Anderson. I'm actually a Medicare benefits advisor, kind of a tattooed name. But my job is actually to help people navigate Medicare, to understand in plain, simple English and simple terms what it is to be a good consumer of your Medicare benefits and how to navigate Medicare. Most people find Medicare, the mystery of Medicare is what I call it, pretty confusing. And my job is to help you get it right. I'm a big advocate of education. You can sit down with somebody and they can just point you in the right direction, or you hope it's the right direction, and give you a pat on the butt and send you out the door on your way. But really understanding how Medicare works, the complexities of it, if you can grasp some of that, it makes you a better consumer. So today we're just going to start with some of the pieces of the puzzle that will help you get it right. We're here today to try to make sure that you have that education to get it right. I am AHEP certified, which means that I spend an ungodly amount of time every year certifying with the federal government. That's when we get brought up to speed on any changes that have been made to Medicare on an annual basis. You get one shot to get it right, similar to enrolling in Medicare. So that education process is something I take very seriously. I'm licensed and appointed as an insurance agent. So in order to help people facilitate Medicare health plans, you have to be an insurance agent, and you need to be licensed in the states that you assist in. And you also need to be appointed with each carrier. So in the United States, I'm appointed with all of the large carriers. There's some regional carriers that populate some areas that we may not be appointed with, but I am appointed with all the major carriers. I'm also an active member of the National Health Underwriters Association, as well as the Association of Medicare Supplement Advisors. These are two organizations that spend a lot of time with the Ways and Means Committee and advocating for Medicare benefits on behalf of the Medicare beneficiaries, as well as the Medicare advisors throughout the country. So it's a pretty powerful organization, and it really does speak volumes when we can take from you, the Medicare beneficiary, through us, your Medicare advisor, back through these organizations to tell the people who are making the decisions what's important. So later on in the week, we're actually going to look at some of the changes that are coming for Medicare that are pretty exciting. I'm really happy about it. People ask me how I got to this point in my career and why did I choose Medicare, because it's really confusing, and it is a little bit confusing, or a lot of it confusing, depending on how much time you've spent. And my answer is always my grandma. I grew up spending summers with my grandma. She was kind of my hero. And as we all do, we age into illness at some point. Hopefully not all of us, but she did. And it left me to a point where the information we were receiving wasn't clear and concise, and she really missed out on some of the benefits that she could have taken advantage of as a Medicare beneficiary. And so I kind of took it upon myself to be able to explain these things in clear terms for people, so that what I learned trying to help my grandma would also help those that I touch, everyone that I touch. If there's something I can do to help you today, please let us know, and I'll be happy to try to answer those questions. So we're going to go ahead and get started. Today's session is going to be how and when to enroll in Medicare. Whoops. So we're going to talk about Medicare, what it is. Most of us are a little bit unsure. We just know it's something that happens when we turn 65. Medicare was put into force in 1965 is when Medicare was voted in. And it was never designed to be all-inclusive healthcare. It was designed to help pay for some expenses for Medicare beneficiaries, but not to be all inclusive. So definitely not the Medicare that we see today. But Medicare is your federal health insurance plan for eligible U.S. citizens and legal residents. We fund Medicare via our tax dollars. We've paid our FICA taxes in, every time you get your paycheck, you can see that they've deducted a good swapping amount out of that for various programs. But what Medicare deductions or your FICA taxes don't do is they don't put all of that money into one big bucket with your name on it. Therefore, you draw out those benefits later on. Medicare is funded for the next generation. So we have paid into our FICA taxes, funding our elders' care, and your younger generations, your children and your grandchildren, are funding your care. So it is not necessarily a big deposit that you've made and you get to withdraw later. Medicare's individual. So even though some of us may be able to enroll based on our spouse's contributions, it is an individual choice. Each person's Medicare enrollment is based on their Social Security number. So you know that we don't share Social Security numbers, or at least we're not supposed to. Your Medicare enrollment will be individual to you. And that's very important when we start looking at plans later on to understand how that works. Some things that Medicare is not. So remember I just told you about all those FICA taxes that we paid, and that's how Medicare is funded? Well, when we go to enroll in Medicare, it's not free. And this is a big shocker for a lot of people. A lot of people think that because we've paid in, they have that perception that there's a bank account of funds that they've contributed that's going to pay for their health care. Not the case. So there are costs involved with Medicare. Medicare's not a family health plan. So some of us who are eligible to begin our Medicare benefits may have dependents in our household that are covered currently under our health plan, our health insurance plans. So if you are Medicare eligible and you have dependents, your spouse, your children, maybe you're taking care of grandchildren, know that Medicare is not a family plan. It is individual, so only the Medicare beneficiary can enroll. It is not Social Security, though they are connected, and the Social Security Administration manages the Medicare monies. So Social Security is the bank, so to speak. They're not simultaneously connected. When we talk about the correct time to enroll in Medicare, it no longer correlates with the time that you're eligible for your entire Social Security retirement benefit. So some of us who are aging in to Medicare at this point in time, let's say you're turning 65 this month, your full Social Security retirement benefit is not available to you until you are 66 and some months of age. So it's very important to know that those dates are separate. The other thing that people get confused about is Medicare being Medi-Cal or Medicaid. So for those of you that are joining for California, we changed the name of everything in California. So Medicaid is federally the name of the program that funds health insurance for low income and underserved individuals. In California, we call it Medi-Cal. So we're going to talk about who can enroll in Medicare. So there are some qualifications that you will need to meet in order to be eligible for Medicare. The first qualification is that you have to be age 65 or older, unless you have a qualifying disability. So those of us who may have a qualifying disability will have an elimination period. So that means the time that you're diagnosed with that disability and the months that are required for you to maintain that disability if you will. So meaning you're not getting better, it's a permanent disability, then you'll be eligible for Medicare. We also have Medicare immediately available for people who are diagnosed with end-stage renal disease, or we call it kidney failure. You need a kidney transplant, or you're on dialysis, or ALS, or Lou Gehrig's disease. It is not available for anyone outside of those qualifications. You also need to be a U.S. resident or a legal, U.S. citizen or a legal resident. We have a lot of folks that might be immigrants who have come into the country, are working and paying their FICA taxes. They will need to have had 5 consecutive years of residency before applying for Medicare. When to enroll in Medicare. This is where it gets very, very critical to do this correctly. If you are late or do not have a waiver in enrolling in Medicare, we have a surprise for you. It's called penalties, lifetime penalties, and it really stinks. It's just, you can do a lot of things wrong. We've all made mistakes, right? You can file your taxes with the wrong information. You may have a little bit of a penalty to pay, but you can go back and refile them and correct everything. I hear tax attorneys on the air all the time advertising they can fix what we did wrong. If you get your Medicare enrollment wrong, there's nobody we can call to get that fixed. So it's very important that you understand how to do this. And we're going to dip into it just a little bit more right now. So we get one initial enrollment period. Your initial enrollment period begins 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months following your 65th birthday. That is your initial enrollment period. And that occurs once in your lifetime. Yep, I did say once in your lifetime. So if you enroll, let's say your birthday is April, as we have looking at here. We enroll in January, February, or March. Your Medicare benefits will begin on April 1st, or the first day of your birth month. So a lot of my clients ask me, well, I don't turn 65 technically until the end of April. Well, you get a little gift from Social Security and Medicare. Your benefits will start on April 1st. Now, if you didn't get to Social Security on time, you haven't enrolled in Medicare, your 65th birthday comes around, you're celebrating with all your friends. Hopefully soon we get back to celebrating in person. And your best friend turns to you and said, "Did you enroll in Medicare?" Oh, no. Totally forgot. Didn't even give it a mention. You enroll in April, your benefits can be delayed up to 2 months. So when you're coordinating timing of maybe leaving an employer-sponsored coverage, or you have individual coverage that will no longer cover you after the age of 65, be cognizant that they will penalize you up to 2 months for that April, May, June, July enrollment. I mentioned penalties. So let's talk about what the penalty is for a delayed enrollment. So for each 12 months that you delay your Medicare enrollment and do not have a qualified waiver, which would be job-based insurance, you are looking at a 10% penalty. That's 10% of your Part B premium. Remember, we talked about Medicare not being free. You do have a monthly premium that you would pay for your Medicare benefit. If you delay your enrollment, you're going to pay a 10% premium. So let's say that you turned 65 in 2013. And I hear it all the time. Actually, I even heard it from my own grandfather. I'm healthy. I don't go to the doctor. I don't need any medications. Why would I enroll now? I don't want to pay the premium. Well, so you delay, and now it's 2020. Maybe we need to go see the doctor. Maybe there's just that little angst that you should probably have insurance now. Your premium would be significantly higher than if you had enrolled in 2013. So take the $144.60 premium, that is the 2020 premium, add the penalties in there, and now we're looking at $245.82 a month. That's going to add up over the course of our lifetime. So please make sure that when you're considering delaying your Part B enrollment, that you have a qualified waiver so that we don't have to talk about these penalties. In addition to the Part B penalty, there's a Part D penalty. We'll get into Part D a little bit more later on in the week, but the Part D penalty also is for those of us who did not enroll when we needed to. If you have credible coverage, you can delay your Part D, which is your drug coverage enrollment, but just know that outside of that initial enrollment, that 7 months that we just went through, if you lose your credible coverage, which is the reason you're delaying Part D, I know this is getting confusing, you only have 63 days to replace your coverage. So going back to the timing, it's really important that you consider where you're at and what coverages you might need, and make sure you get the timing correct. We don't want to have to talk about Part B and D penalties for the rest of your life. So now we're going to talk about what affects most people, and that's when do I enroll if I'm working. So most of us that are 65, we have continued to work. We've worked a little bit past the age of 65, and that's perfectly fine. We just need to understand that if we decide to keep working, where we fall in Medicare's guidelines. First question that you need to ask if you're continuing under an employer-sponsored plan, which would be a qualified waiver, is whether or not your employer has more than 20 employees. If you're working for a small employer, or maybe you're the small employer, and there's less than 20 employees, you must enroll in Medicare. Medicare Part A and B will be your primary coverage. You do not get an exemption. So we're going to go over that one more time. If you have an employer with 20 or less employees, you absolutely need to enroll in your Medicare benefits. When you're looking at those Medicare benefits and your employer-sponsored coverage, you need to do a comparison. Lots of folks will take time to look at their employer-sponsored coverage because your HR department's figured it all out for you. They've given you your options. You've got your PPO, you've got your HMO, you've got Plan A, you've got Plan B. It's pretty much a wrapped up package. But when you're looking at comparing that to Medicare, do compare the cost of Medicare and the benefits. Many times Medicare is more favorable than what your employer-sponsored plan is providing. So if you do need to enroll in Medicare, you need to do that within that initial enrollment period. So that 7-month window, the 3 months before and the month of, let's make sure you do it in the 3 months before so you don't wind up with a lapse of coverage. You can enroll in Medicare by either calling the Social Security Administration on the phone, going to the Social Security Administration's website. You can go through Medicare.gov's website as well, and you want to get that enrollment completed. If you are delaying your enrollment or you're planning ahead and you're contributing to an HSA is a health savings account. So if you are delaying and you are contributing to an HSA, you need to also delay your Part A enrollment. The reason being is the HSA is a tax advantage, and those rules are managed by one portion of the government. Medicare is another program managed by another portion of the government, and little secret, they don't talk to each other about the rules. So the rules for an HSA contribution, if you are Medicare eligible, you'll need to stop contributing 6 months prior to your enrollment in Medicare. If you continue those contributions up to your enrollment in Medicare, you'll be looking at some tax penalties and possibly or unfunding that HSA for those 6 months. So that's a caveat. If you're taking notes right now and you're contributing to an HSA, please make a note that we need to talk to you about timing and make sure that you don't set yourself up for some penalties. If you are not working past the age of 65, you need to enroll in Medicare during your enrollment period. And I'm going to harp this one for the rest of today, 3 months before your 65th birthday, so you do not wind up with a lapse of coverage. Now, if you had worked and your former employer is offering a retiree plan, this is a gotcha for some people. So heads up if you have a retiree plan option. If you are an active employee working for a company who has more than 20 employees, you can defer your Medicare, no penalties. If you are working for a company who has a retiree program, and let's say you were able to retire a little early, you retired at age 63, and you participated in the retiree program because you're no longer an active employee and we got a great retiree program. Wonderful. Please note that is not a qualified waiver for Medicare. So if you're in a retiree program right now and you're turning 65 sometime soon, you will need to enroll in Medicare. Now, you may be able to continue in that retiree program. It may serve as supplemental insurance, but know that you need to have your Medicare A and B as primary, or you may be looking at those penalties that we just talked about. Shopping and comparing, I briefly mentioned this and I'll mention it again. If you do have employer-sponsored coverage or a retiree plan, you do want to do a cost comparison and an analysis. Sometimes people ask me, why is Medicare, when I enroll in Medicare and I pick a plan that works with Medicare to help cover some of the expenses that Medicare doesn't cover, why is it so much cheaper? And I'll share with you just a little bit of the insurance underwriting world. When we are working for an employer, let's say it's a medium-sized employer, they got a couple hundred employees, they can negotiate some with the insurance carrier. And usually the common age of the membership they have is below 65. However, those of us that are 65 statistically will cost more. So your employer is going to have to compensate somewhere for the premium. And usually that means that our premiums collectively are a little bit more expensive. Very large employers have different underwriting regulations and rules, but in general terms, we're going to be the older group in our insurance. When we turn 65 and we move into Medicare, we're now the babies, we're the young ones, we're the healthy ones. So the premiums for the coverage tend to be a lot less expensive, and we tend to have more benefits in the Medicare programs. Each program has its own pros and cons. We'll get into that a little bit later in the week as well. But just know that it's a good idea for you to do a comparison, because we don't want to spend any more money for insurance premiums than we need to. it gets pretty pricey the older we get. So if we can put that money somewhere else, in a savings account, invest it, I don't know, some great vacations, it is recommended, and I recommend for all my clients to shop and compare. Make sure you're getting the benefits that you need to maintain your good health. Obviously, that's most important, but we don't need to be overpaying for coverage. A lot of times I meet with people and they're like, nope, I worked for my employer for, God bless them, 30 years. And they have always told me if I stayed on, I would have lifetime benefits as that supplemental retiree plan. Though with restructuring of some of the insurance pieces of the puzzle, if you will, after healthcare reform, some of those retiree plans became quite expensive. And quite expensive because the law forced them to do other things than they had been doing in the past. So bundling that with your Medicare may or may not be your best option. So please be a good consumer, do your comparison, make sure you're getting the benefits that you need to stay well and healthy. As well, there's additional benefits being incorporated into Medicare plans that we might not see in under 65 plans. For instance, some plans have transportation or hearing aids, and we'll talk a little bit about that later on in the week. But you definitely want to make sure that you're avoiding your late enrollment penalties. So your initial enrollment 3 months before your 65th birthday, unless you have a qualified waiver. Qualified waiver will be an employer plan that has more than 20 employees, and you can have that qualified waiver until you decide to separate from your employment. So whether that's retirement, unfortunately, there's some folks that are shifting gears and changing their retirement plans right now with COVID, changing the dynamics of some people's employment or what have you, you do have that qualified waiver, and that will avoid the Part B and D penalties. If you are continuing to work past the age of 65 and you have a health savings account, please be aware that you need to do some additional planning so that you do not wind up facing a penalty, a repayment tax penalty with the HSA contributions. So Bethany, I'm going to pause for a minute. Do we have any questions that need to be answered at this point?
Yes. So someone had a question about their plan, and they're currently paying a premium every year for a plan that they barely use. So she's paying a monthly premium, and she only goes to the doctor once, but her insurance agent is basically saying you should have this plan in case something happens, and she doesn't know if she's wasting her money or if she should continue to have this plan so it doesn't go up. And I don't know if it would go up as she gets older, even though she's healthy.
All right, that's a loaded question. There's a couple pieces of the puzzle there. So first, when we'll get into a little bit more detail later on in the week in regards to plan types, plan designs, but I'll just kind of hit this at a high level right now and see if we can't help out just a little bit. So Medicare A and B is kind of what we're covering today. You can purchase additional coverages to help cover expenses that Medicare doesn't provide for. We have basically two types of structures that are available to do that. One would be a Medigap or Medicare supplement plan. And based on the premium dollar that she mentioned, I would guess that she's in a Medicare supplement plan. Medicare supplement plans, they follow original Medicare. So I always tell people, if you can figure out how the money flows, you can figure out how things work. So how the flow would go with a Medicare supplement plan is Medicare would pay first. So she goes to see the doctor, her one doctor visit a year, and the doctor's going to bill Medicare. Medicare is going to pay some of that expense. And if she has a supplement plan, depending on the supplement plan design, it's going to pick up some or all of the remaining expense. Most of the country, the plans do increase as we get older. So if she is in a Medicare supplement plan, she is paying premium dollars every month. She may want to look at a Medicare Advantage plan, which typically are a little less expensive. It just really depends on what her care network looks like. So Medicare Advantage plans are available state by state and county by county. We'll get into how those work later on in the week, but she definitely should take some time and review all the options that she has available to her. Some folks like to tell you that you need to plan for the worst case scenario. And insurance, that's what we do, right? We plan for the worst case and hope for the best, and somewhere we'll be in the middle. However, if she's spending significant amounts of money on an annual basis that she may be able to put somewhere else that would provide other luxuries or securities for her, it might be something that she wants to look at. If we talk about Medicare Advantage plans, know that under the Medicare guidelines, Medicare Advantage plans must provide the same benefits that original Medicare provides. So you're not cutting out, say, a doctor's visit or something of that nature being covered. You just may have to participate with a network of doctors. So potentially that network may be different than doctors that you would have access to just strictly with original Medicare, but there may be an option there for significant savings. And a caveat note is Medicare supplement plans or Medicare Medigap plans don't include prescription drug coverage. So she would be adding that on as an additional coverage, and maybe that's built into the number that she provided. But most Medicare Advantage plans have prescription drug coverage bundled in. That's why they kind of call them Medicare Insurance plans. But I would definitely sit down and do some shopping, take a look at the region that she's in, look at the healthcare delivery system that's available to her, and determine if that investment is actually the best investment for her at this point in time.
Okay, another question. If I am working, can you just clarify that I must enroll for Medicare even if I have healthcare coverage now through work?
If you are working and you are covered underneath a employer-sponsored plan that has more than 20 employees, you do not need to enroll in Medicare today or when you turn 65. So as long as you are working for an employer who has employer-sponsored coverage available for you, and there's more than 20 employees, you do not need to enroll in Medicare. You can enroll in Medicare Part A. Part A is premium free, so you're not paying anything on a monthly basis for that. But you do not need to enroll in Part B. You will have a waiver. If we went back and looked at the slide for the penalty this year, 2020, the Medicare Part B premium is $144.60 for base income. So if you're working and you have employer-sponsored coverage, you don't necessarily need to pick up that $144.60 additional premium. And if the person's still on who asked the question, if that needs additional clarification, just feel free to let us know.
Okay, and then Bonnie had a question. Do I understand you mean that everyone who's self-employed, less than 20 employees, will be forced to switch over to Medicare whether they want to or not at 65?
That's correct. If you are self-employed and you have a small employer group and you are looking at what the cost associated with that, you might feel a little bit more relieved when we get into some generalizations of cost. But yes, if you are self-employed or an employer with less than 20 employees, you will need to enroll in Medicare Part A and B at age 65, and that's that initial enrollment period, 3 months before you turn 65. Do we have any more, Bethany?
No, that's all we have.
That's it? Okay. And whoopsie. Sorry about that. My little hot little finger wasn't going, and then it decided to go too fast. So for those that need to enroll in Medicare, there's a couple ways that we can do this. We used to be, we just told you to go down to the Social Security office in your neighborhood and enroll. But those have been closed now for the last 6 months. So you can either call the Social Security Administration or Medicare via phone call. I will tell you that they have extended hours. So typically after 5 p.m., the hold time is a little less than it is during the middle of the day. That's your insider secret for the day. You can go on to medicare.gov. Make sure you're on the .gov website and enroll in Medicare online. That will work for anyone who does not have a credit hold. What is a credit hold? So you put a hold on your credit so that somebody can't walk into a retailer and get same day credit. You know, you walk into the furniture store and they give you whatever, a 6-month deal on credit. If you have put a credit hold on with the credit reporting agencies, you cannot enroll in Medicare online. The reason being is the system that they use to validate you is also the same system that the creditors use to validate you. So you can either walk into or make an appointment for a local Social Security office. Hopefully they'll be open soon. Call them directly or go online. You'll want to start your paperwork as early as possible if you need your Part B Medicare to begin on your 65th birthday. Now, once you've enrolled, there's a couple documents that you will receive. The first document you usually receive is an acknowledgement that they received your request to enroll. This document is, how do I want to say it without seeming to be really putting it out there? This document sometimes is copied, the look of it, by insurance companies or large call centers that are trying to get you to enroll in Medicare through them. Now, they're not trying to help you enroll in Medicare Part A and B like we are doing today. They're just trying to put you in the plan that they represent. So please make sure that all the documentation that you are going through, you're identifying this documentation that's coming from the Social Security Administration. So please read the small print on everything you get, that little tiny print at the bottom. Get a giant magnifying glass and look, they have to put on there that it's an advertisement. If it is an advertisement, they just don't have to put it very large. Then once you you'll receive that letter, then you'll receive a letter with your Medicare card, your red, white, and blue card. You'll have, it'll contain your name. It'll have what I call the BOM code, which is the identifier that is your Medicare beneficiary ID number. It's your claim number. And then it'll have dates for hospitalization Part A and your medical coverage Part B on the lower right-hand corner. Once you have that, you are set to begin your Medicare journey. You will need to pick up a drug coverage. We'll talk about how you do that later on in the week. And you will also need to probably consider some type of insurance that works with Original Medicare so you're not at risk of significant medical costs should something happen. As we get into the 65 birth window, is what I call it, usually about 6 months before, your mailbox will begin to fill up. It is quite an event. your name falls on a marketing list, and every insurance carrier that services your area will send you some information or a lot of information. Find somebody who can help you muddle through that. I have clients walk into my office with trash bags full of advertisements. Most of the advertisements, because they are governed by Medicare, what they can and cannot say, look identically. You put your hand over the name of the insurance carrier, the benefits that they're allowed to put on that marketing material are exactly the same. So just do yourself a favor, don't save all of it. Look for that small print to know what is an advertisement and what is actually your documentation from Social Security Administration. And I wish you the best in recycling. Do we have any other questions, Bethany?
No, I think that's it.
All right. Well, we're just under on time, so we'll give people back a couple more minutes in their day. If there are any other questions that you come up with, feel free to reach back out. We'll be happy to get you guys information, whatever we can do to make your Medicare journey pleasurable as much as possible and get you enrolled on time. Thanks so much for your time.
Thank you. And Denise actually has a checklist that we'll send out as well. So we'll send you an email that gets you ready for that 7-month window, the magic, what'd you call it? What's your?
What's going on here? Your IEP, your initial enrollment period?
Yes, so we'll send you out a 2-page checklist that says this is what you need to do 7 to 9 months before. This is what you need to do 6 months before. It's broken out kind of by the time period. So you'll have something like that you can help. So Denise, somebody asked, how do they find someone like you in their area that can help?
Well, that's a very good question. How do I find myself? I look in the mirror. No, I'm just kidding. So usually what I tell people to do is start with friends and family. Friends usually like to share with you everything that they've done to mitigate their Medicare madness. But Medicare's not a one-size-fits-all. So just because your friend picked this insurance and this drug plan doesn't necessarily mean it fits you perfectly. So start by asking your friends and family members if they have an advisor that they've used, that they felt confident in. And then go ahead and make sure that the advisor you pick has options for you. So what you don't want to do is wind up with a call center. Most of the marketing that you're going to get is from a large call center where they have many plans, but you don't have direct access back to the advisor if you have a question. So heavens forbid, insurance, we all have questions. So you kind of want to stay away from those large call centers. You want to look for an independent agent who has license and appointure with multiple providers or insurance carriers. You want to be able to look at all your options in one place and have somebody navigate through them. Unfortunately, if you just go Google Medicare, you'll wind up with a plethora and pages and pages and pages of insurance carriers looking to help you. But unfortunately, when you talk to the insurance carrier themselves, their vested interest is having you enroll with them, not necessarily making sure that you have the coverage that you need. So I always say start with friends and family. If you work with a financial planner, a CPA, they usually have somebody that they refer to. Whoever your advisors might be for other fiscal opportunities, they usually have good connections, and that's where I would start.
So what states do you serve?
I am California, Arizona, Nevada, Oregon, Washington, Utah, Colorado, and Idaho. I'm the West Coast girl.
So what would Bonnie ask? What would she Google or to find a title of someone like you?
Bonnie, I would try Medicare Broker near me or Medicare Insurance near me. And if they come up in the Google search, that would probably get you started in the right direction.
Okay. Because I think Debbie had a question. She was the one who had the specific amount that she was paying, but she's super healthy and trying to figure out whether or not, so she wanted to speak with someone else like you that's not trying to sell her, but Debbie's in Florida. I think. Debbie, aren't you in Florida? I expect everything to be instant. So I think Debbie's in, she has a Florida number. So she was saying, how can she find someone like you that's not selling, but you don't service Florida?
I don't. We can, hey, Debbie, make sure that we have a way to get a hold of you, and we'll see if we can't help you out.
I think that's it. Most of the questions were really about how do they find you, or how do they find someone like you? But I'm going to tell you guys to try and make it here at 3 o'clock every day, because Denise is going to give us her time. Even though she has her Medicare certification test on Friday, she's still, because I just wouldn't let her say no, is still going to be here every day Thursday, or every day at 3 p.m. So every day we'll cover. Tomorrow we go over all the parts and pieces and plans, and it's a lot. And then this is the lightest day. This is the fun, light day. And then we go through what's the best plan, and also the Part D, which is the prescription plan. So if you have any questions around those more specifically, then please try to make it here at 3 o'clock, because you have Denise and her attention. And she's in career, and she's just amazing. I told you.
We just want people to be good consumers of their benefit. You guys have worked so hard. You've, paid your FICA taxes, but you've worked so hard, and you really should be able to have, everything that you need to keep yourself healthy, happy, and enjoy retirement.
So Debbie, I'll make sure that Denise has your information. There are a couple Florida gals in here. So if you can find a Denise Florida clone-ish, then that would be great. And I'll make sure that Denise has your contact information, ladies that are in the chat. It's all women here. It's just all women. I wouldn't expect anything less. But thank you so much. So we'll be back on tomorrow talking about the parts, all of the parts. We're going to really talk about A, B, C, and D, which are the major parts. There's many others, but those are kind of the core and the most important. So if you can make it, show up tomorrow at 3. If not, we will have it recorded, and some of the emails are going to spam. So please make sure that you check your promos folder if you're in Gmail, and junk and spam, and everybody else. Unfortunately, most spam people have ruined it for the good people that try to get you information, and it makes us hard to get information to you. So I'm so sorry. I know Debbie and a couple other people had problems, and Bonnie said women rock, and they do. So I apologize in advance if it's going to spam, and if you came late because it didn't go through. That's why we try to send several, to not be annoying, to just make sure you get it. But Denise will be back tomorrow, and thank you all for joining. We really appreciate it. Bye.